Hey, did you see the kid's scan? Yeah, it looks like the appendix just burst. And mom said that they waited a while because they were worried about COVID in the hospital. That's a good point. I wonder how the COVID pandemic affected when these patients presented to the hospital. I'm Rod from Cincinnati Children's, and I think this is the article you're looking for. In this retrospective review, the researchers looked at pediatric patients who presented with acute appendicitis before and during the height of the COVID pandemic at a single institution. What did they find? Of those pediatric patients who presented during the height of the COVID pandemic, there was a significant increase in the number of days that they waited to come to the ED. They were significantly more likely to present with a reported fever, they had a significantly higher heart rate, and they were more complicated. They were significantly more likely to have either a perforation or an abscess on imaging. And then their treatment was even different. They were significantly more likely to get antibiotics and non-operative management. I have another article review about that stuff from like 6 months ago. You should look at that one too. And then their course was even different. They had a significantly longer hospital stay and a significantly longer time until their symptoms went away. So what'd you see at your hospital? Leave a comment below.